The following is a presentation on telemedicine, the future of healthcare delivery, by Phillips, Pittman, Ramsey, and Sheehan. The vision of our hospital is to create an integrated community health system using the most advanced health information technology systems to increase healthcare access and improve the health of those we serve. One of these advanced health information technology systems is telemedicine, which plays a vital role in realizing this vision. According to Zhang, the definition of telemedicine is the practicing of assessing patients remotely using video conference, digital photography, instant messaging, or other technology. And Provencer and Nucio describe the purpose of telemedicine as increasing access to healthcare by transitioning patient care from the physician's office or clinic to the patient's home, in addition to providing patient access to urban providers from rural areas. There are four primary considerations in the adoption and implementation of telemedicine. These are benefits, costs, concerns, and next steps to address. Let's explore each of these in more depth. We begin by reviewing the benefits of telemedicine. According to Augsburger, while the Centers for Medicare and Medicaid Services and Congress have been slow to appreciate the benefits of telemedicine and telehealth, most states are rapidly expanding its availability. In fact, telemedicine has been growing rapidly over the past few years, mainly due to four fundamental benefits outlined by the American Telemedicine Association. First, access has been improved by allowing physicians and healthcare facilities to expand their reach beyond the office or clinic to the patient's home. In addition, telemedicine has improved access and healthcare delivery by connecting urban specialists to patients in more remote locations. Second, telemedicine improves cost efficiencies by reducing or containing healthcare costs through better management of chronic diseases, reduced travel times, and fewer or shorter hospital stays. Third, telemedicine improves quality. In fact, studies have consistently shown that the quality of healthcare services delivered via telemedicine are as good as those that are received in traditional in-person visits. This is expected to increase patient healthcare usage and therefore improving the overall health of our community. Fourth, and perhaps the greatest impact on telemedicine, is addressing patient demand. Due to its convenience, telemedicine seems to be becoming the preferred method for receiving healthcare services. Such services offer patient access to healthcare providers that may not be available otherwise. Moving to costs, there are both direct and indirect costs to consider. In an article titled, "I Want to Do Telemedicine, What is Involved and How Much Does It Cost?" the author emphasizes that with the vast amount of telemedicine technology and equipment options available, it is essential that organizations pick systems that fit their budget as well as their infrastructure needs. Furthermore, according to Oates, for those providers that have implemented telemedicine in their practices, there are statistics that show the impact on profits and losses. For example, first, telemedicine saved consumers on average about $5,600 in direct and indirect expenses. Second, society experienced a net gain of about $3,800 per patient. Finally, although the savings happened on the consumer end, using telemedicine added on average $1,700 per patient to treatment costs, all of which should be considered. In regard to direct costs, for those providers looking to add telemedicine to their services, the article "I Want to Do Telemedicine" highlights four primary implementation costs to consider. The first is the cost of basic medical devices, which include an examination camera, ENT scope, and digital stethoscopes ranging from $5,000 to $10,000. The second is the cost of communication platforms for both software and hardware. Software-based video communication can cost as little as $1,500 per patient and no cost to the remote provider, while hardware-based video communications can start around $10,000 per patient and increases with the number of remote providers. The third is the cost of packaging, design, and mobility. For example, all-in-one systems that include software, primary care devices, and mobile cards range from $20,000 to $28,000. And the fourth is the cost of training for technicians, clinicians, nurses, and technical staff, which range from $200 to $2,000 depending on the complexity of the equipment and other factors. In turning to areas of concern in the use of telemedicine, there is a wide range of concerns to consider. In fact, according to Zhang, underwriters, lawyers, insurance brokers, and healthcare professionals need to understand the regulatory and liability issues surrounding telemedicine and the large coverage gaps that may exist with current professional liability policies. There are three very broad areas of concern to consider when implementing and using telemedicine. The first concern is unstandardized and underdeveloped regulations for telemedicine use. According to Zhang, from a location standpoint, current regulations fail to clearly indicate who is responsible for liability claims for services rendered remotely across state lines, emphasizing that some liability insurance only covers the physician practicing in their own state. In addition, Zhang points out that regulations for standards of care vary by state, and most states lack standards of care for telemedicine altogether. Finally, Zhang points out that most fraud and abuse guidelines are written for face-to-face visits and lack clear expectations for services rendered virtually through telemedicine devices. The second concern is poor integration and security of health information technology devices used in telemedicine. As indicated by Zhang, malpractice claims could rise as a result of poorly integrated systems that fail to provide all pertinent patient data, such as allergies and comorbidities. In addition, such poor integration and security safeguards can also result in data breaches, misdiagnoses, and incorrect medication administration. Finally, the third broad concern is that patient experience can be compromised if the adoption of telemedicine services is not given careful consideration. Malhotra points out that the lack of focus on all the essential parts of the patient's telemedicine visit can result in a very unnatural visit and unlikeliness that the patient will want to use the service again. Galbraith emphasizes issues in technology access and understanding of technology, indicating that minorities, poor, and elderly patients lack access to the necessary mobile health information technology needed to use telemedicine from home and also lack an understanding of how this telemedicine technology works. Understanding that there are a variety of concerns in the use of telemedicine, it is imperative that we consider solutions for addressing these. In fact, according to Osberger, given the complexities of federal and state telemedicine regulation and standards and the varying expansion rates, building a successful, compliant telemedicine practice must include a tolerance for uncertainty and a creative approach to furthering policies in today's technological context. Just as there are three broad concerns in the use of telemedicine, there are also three broad solutions to address these concerns. First, given the variation of state and federal regulations and standards, it's imperative to standardize as much as possible. According to MUCA, the state medical boards are already adopting standardized guidelines for physicians using telemedicine. This alignment involves four areas. First, the physician must be licensed by or under the jurisdiction of the medical board of the state where the patient is located. Second, that the physician must take appropriate steps to establish an acceptable patient-physician relationship that follows the standard of care. Third, the physician must collect and document relative clinical history and perform a medical evaluation of the patient before providing recommendations, treatment, or prescriptions. And fourth, documentation of patient-informed consent for telemedicine use must be obtained and maintained. While the medical board is working to align some of their guidelines, there are many other governing and regulatory bodies to align in these efforts. Perhaps the Office of National Coordinator for Health Information Technology could be assigned to coordinate such efforts across the nation. The second broad solution to addressing telemedicine concerns is to implement standard processes and expectations for health information technology integration and security. According to Koldner, the multidisciplinary team must be formulated in the organization. That includes information technology specialists, clinical staff, and providers. This team would work to ensure that new telemedicine technology systems integrate with existing health information technology and is secure. Furthermore, this team would be visionary in their selection of the new telemedicine technology, working to select a system that is flexible as services expand and regulations change. Finally, an additional solution is to expand and standardize the regulatory efforts of the HITECH and HIPAA Acts. The third and final broad solution to addressing telemedicine concerns is to develop and implement consistent standards to enhance the patient experience. This can be accomplished in several ways. For example, according to Malhotra, there needs to be a focus on 3 parts of the patient visit to ensure a natural and quality experience. The first part of the visit comes before the patient arrives. This part focuses on having infrastructure and multidisciplinary team in place that outlines what each person's role is. The second part is the visit itself. This part involves ensuring a comfortable environment for the patient is in place with proper lighting and backdrops to improve contrast, and all the necessary telemedicine tools are prepared. And the third part of the visit is the follow-up, which involves follow-up testing and medications, as well as notifying the primary care physician of the visit. Finally, as one additional consideration to ensuring a positive patient experience, Galbraith suggests community outreach and educational programs that focus on internet and telehealth literacy. In conclusion, there are many benefits, costs, concerns, and solutions to consider when implementing telemedicine services. The primary benefits are improved access, cost efficiencies, improved quality, and patient demand. Additionally, there are direct and indirect costs to consider, and these costs vary based on the depth in which telemedicine services are implemented. Furthermore, there are 3 broad areas of concern that must be addressed to improve the success of telemedicine delivery. These are unstandardized and underdeveloped regulations across the nation, poor integration and security of health information technology devices, and the third, a compromised patient experience. There are suggestions to resolving all of these concerns by standardizing regulations, improving integration and security, and development of consistent standards of care to improve the patient experience. While there are pros and cons to telemedicine, there is a strong argument that the addition of telemedicine services are imperative to ensuring that our growing and aging population has access to quality health care to improve their health and well-being. The following references were used in the development of this presentation. This concludes our presentation. Thank you so much for tuning in.